Learning medicine is hard work, so don't learn. Imbibe Med. Imbibe Med brings you a short quiz on this topic. The link is in the description below. Attempt the quiz before watching the video to see how much you already know about this topic and how much you learn from this video. And do tell us what you think about it. So let's dive right into the topic. Clavicle. The collarbone is known as the clavicle. Another fancy word. The word clavicle, however, means a small key because of its shape. It is quadrangular in its medial part and flattened laterally. The medial 2/3 being quadrangular has 4 surfaces: anterior, posterior, superior and inferior. The lateral 1/3 is flattened and has only 2 surfaces, superior and inferior, and 2 borders, anterior and posterior. The 2 ends unite with the other bones. The lateral or acromial end bears a facet which is oval in shape and articulates with the acromion process of the scapula to form the acromioclavicular joint. The medial end, which unites with the upper part of the sternum called the manubrium sterni, is quadrangular. Along with the variation in shape, it has variations in the curves. It is curved convex anteriorly in its medial 2/3 and convex posteriorly in the lateral 1/3. The inferior surface has 4 important markings: trapezoid ridge, conoid tubercle, subclavian groove, and impression for sternoclavicular ligament. The trapezoid ridge and conoid tubercle give attachment to the trapezoid and conoid parts of the acromioclavicular ligament. The subclavian groove gives insertion to the subclavius muscle, and the oval impression at the medial end gives attachment to the sternoclavicular ligament between the rib and the clavicle. 6 muscles and 2 ligaments attach to this bone. The 6 muscles being subclavius, deltoid, pectoralis major, sternohyoid, sternocleidomastoid, and trapezius. The subclavian vessels and cords of brachial plexus pass towards the axilla lying between the inferior surface of the clavicle and upper surface of the first rib. The subclavius muscle acts as a cushion to protect these structures from damage. The clavicle is the only long bone which lies horizontally. Its primary function is to transmit the weight of the upper limb to the axial skeleton. The clavicle supports the shoulder so that the arm can swing clearly away from the trunk. The clavicles may be congenitally absent or imperfectly developed in a disease called cleidocranial diastosis. In this condition, the shoulders droop and can be approximated anteriorly in front of the chest. Fracture of the clavicle results from a fall on an outstretched hand. The most common site of fracture is the junction between the 2 curvatures of the bone, which is the weakest point. The lateral fragment is displaced downwards by the weight of the arm. The medial fragment is pulled up by the sternocleidomastoid muscle. To summarize, the clavicle can be placed in an anatomical position by recognizing the 2 facets, medial being quadrangular, lateral being oval, 2 convexities, medial 2/3 being convex anterior, lateral 1/3 being convex posterior. Markings on its inferior surface: the conoid tubercle, trapezoid ridge, subclavius muscle, sternoclavicular impression. That's all for today. Imbibe Med signing off. Stay curious. Bye-bye.